professor of radiodiagnosis in women imaging in Asr Al Aini, and we are all wanted to hear her special talk today. You are really very special, Sahar.
دكتورة سحر، نوران، منال، دكتورة حلال. أنا عايزة أقول أنا مبسوطة جدا بالمؤتمر، يعني أول مؤتمر لوزارة الصحة this is حاجة يعني باني honorable وحاجة تفرح من وأنا داخلة كده وأنا شايفة وزارة الصحة والمؤتمر بتاعها وكل البراند نيمز في البريست ايمجينج موجودة فيها، وأشكر نوران على إنها يعني عملت الكولكشن الحلو ده. البرزنتيشن about the artificial intelligence with assessment of the mammogram. We start by something we all know, that the sensitivity of mammograms is lowered by the overlapping of the glandular tissue, especially in dense breasts with HCR, C, and D. Now with the AI, which is the computer programs smart enough to imitate the human mind behavior, we can do AI with the mammogram reader to increase the detection rate for breast cancer and so reduce the workload issues. It has been about 2 years for the Al-Asrani Hospital, Cairo University, and Bayer Foundation for early detection and treatment of breast cancer. The mammograms have been recaptured with Lunit Insight and MG, where the AI algorithm provides a pixel-level heat mapping. The magnitude of the color hue goes with low to high probability of the breast cancer. Then we have the maximum of pixel-level abnormality scoring, which is the numerical estimate of the confidence of suspicion of malignancy that goes from less than 2% to 100%. And also there is assessment of the breast density categorized in 4 types with a scale range from 1 to 10 that increases with the higher the breast density is. In this case, it's a diagnostic mammogram. The patient is aware such as having a lump in her breast, but yet it's very tiny to go through all these glandular tissues, especially if it is at the end of the day and the workflow is so much numerous. But with 1 second, the AI tells us that there is a large mass in the upper deep center portion of the left breast with the probability of being cancer about 99% confidence. And yes, it was a true positive invasive ductal carcinoma grade 3. And for the right one, it's less than 10% being suspicion of malignancy. It's definitely not cancer. The eye recognition scoring values of the breast abnormality differs from one institute to another. The first question to pop in our mind, could the eye be an option for screening high-risk patients with dense breast and pick tiny carcinomas, or only goes for the large one? Well, actually, in this case, the breast is so much busy with the glandular tissue and the overlapping with the white areas, yet the AI spotted the tiny focus here with the probability of 99% being cancer. It was easily targeted in the ultrasound and in less time, effort for tissue diagnosis. And in this case, the patient has a complaint of a lump in the upper inner portion of the left breast, and the clinician also sent it for the assessment. With the ultrasound, it's only glandular tissue, and the AI tells us there is a low scoring to be a cancer. Going for the abbreviated MRI, which is now the option for screening, give us the same information about there is no abnormality there, and so we can calm the patient. So why not to consider AI supported with the ultrasound to be an alternative option for even the MRI screening? So maybe the dense breasts benefit from the AI. What about the low density breasts? We can go through it without the AI software and no need for it. With this case, it's very clear that we're having only 2 lesions here, this one in the right breast and this one in the left breast. And I guess we can say the patient, we could come the next year, no need to do for either assessment by the ultrasound and there is any lesions or abnormality to go through. But the AI tells me no, there is in the left breast lower inner quadrant a probable cancer. I need to go for different contrast and for my side go deeper for different layers in the breast until I find this Larian distribution of this calcification is very tiny and wasn't seen to me at the first sight. Thanks to the AI, it spotted it in 1 second. And on biopsy, it was ductal carcinoma in situ indeterminate papillary type. May AI not used only for detection of calcification, could be used for discrimination of the calcification and discriminate them into benign and malignant ones. This case, it came from a screening mammogram in the upper outer quadrant of the right breast. There is the classic cluster of malignant macrocalcification. But here, these are the tiring ones, which is a segmental orientation of indeterminate ones. It's the amorphous form. And what about the left breast? It also has some annoying clusters in the grouped calcification. We don't know where to get our biopsy and if the patient is going to benefit from the biopsy. The AI tells me not to worry about the left side, it's only 10%, but about the right side, yes, the area, all the calcification, the cluster and the grouped one high up there, need to be go through. And this was very beneficial because in the ultrasound, there was only no targeting of the cluster of calcification that was related to these tiny masses on the ultrasound. There were other masses here, minions, and so AI color hue targeted and guided the extension of the disease so that not to take a lot of time on the ultrasound to track all these disease. It was a multifocal invasive ductal carcinoma on the right side, and the left side it was fibrocystic changes. Like the eye informed me that's only 10% suspicion of being a malignancy. Can AI affect the BI-RADS of known abnormality in the mammogram? It's very obvious to me, and I give her a BI-RADS. I upgrade or downgrade the BI-RADS. Well, this case, the left side is very obvious that we are dealing with a large mass with some areas here and irritation of the surrounding. It's probably benign on the mammogram. We're not pretty sure who's going to go to the ultrasound, and the ultrasound is purely solid. We may go with the phylloides or the joint adenoma, especially at the left axilla, showing the nodes to be more or less non-specific. The eye tells me no, it's definitely cancer, although it is circumscribed in margin with some irritation in the surrounding area. It's 98% definite to be cancer. I'll go to further step and upgrade my examination to the contrast enhanced mammogram. Here is typically malignant with the REM enhancement, the pathologic enhancement pattern of the malignancy, and those areas of reaction on the mammogram appears to, and was not evident on the ultrasound, appears to be minions. It's definitely here, it's BI-RADS 5. Going through all these BI-RADS categorization, it was by biopsy left micropapillary carcinoma, and we have to put in mind that sometimes aggressive types of carcinomas may exhibit benign features and circumscribed margin. The AI algorithm through the image level fine-tuning could help recognition of these tumors and even more determine its actual extent. And in this case, it's a denser breast, and we have areas of increased densities on the left side. It's suspicious with dermal thickening and nipple traction. It's very suspicious, so it's BI-RADS 4. The AI tells me no, it's only 27% of being suspicious to be malignant. When I went to ultrasound, I found that there is infiltration of the breast parenchyma, but yet with liquefaction, areas of inflammatory conditions and pockets. It's complicated fluid infiltration and not malignancy. It goes with the non-infectious mastitis, the granulomatous mastitis. And so when I found suspicious lesion on the mammogram, and the AI tells me it's a low scoring, why not to go to the ultrasound? It could help the proper management, high physician credibility, and enhance the trust between the patient and the doctor relationship. So definitely low scoring means that I'm dealing with normal mammogram. In this case, the patient is aware of the lump. It's a diagnostic mammogram. It's very obvious on the mammogram, and on the ultrasound, it's a benign mass, yet the AI tells me it's low. So when you find low pattern on the AI, LUNET, AI, MMG, it doesn't definitely mean that I'm dealing with normal mammogram. No, it means that the abnormality you find it have a low suspicion of being malignant. Does always low percentage AI scoring means no cancer and high percentage means malignancy? In this case, the lesion is in the left breast. It's partial obscured when we give it a BI-RADS 3. And the eye tells me low. So I'm going to think like the other cases that I'm dealing with most likely with a benign mass. Then when I go to the ultrasound, it's microlobulated, and the vertical portion is more than the longitudinal portion. I'll go with the cancer suspicion. On the contrast-enhanced mammogram, it's more suspicious with the heterogeneous pattern of contrast uptake in distinct margin, even another minion anterior to the lesion. It was a mucinous carcinoma grade 1. Then I'm going to think if some cancers are hideous to AI. Yes, it picks the cancer, but maybe the cancer type that was the one that makes the AI to fall. Well, this is a demonstration case where we could find two masses here, this one and this one. And the eye have picked this one and didn't pick this one, and picked another one here in the lower inner portion of the right breast. And by pathology, this one was mucinous carcinoma grade 1, it's a false negative, but this one is mucinous carcinoma grade 2, and it was true positive. So it's not about the cancer type, it's about the morphology of the cancer. And here, this is another cancer, ductal carcinoma in situ true positive. And when I come to this case, it picked the three masses with a color hue, very intense, it's red color hue with the probability of 99% being a cancer, and it was multicentric mucinous carcinoma grade 3. So low scoring, yes, goes with no cancer, except when the malignancy on the mammogram presented with a small size. This removes part of the scoring, homogeneity, it's another minus. fat near or low density, this skips another 20% of the scoring of the AI in plain with the breast tissue, and if even more if there is no distortion, it comes with a low probability of being cancer, and no scoring or marking was the mammogram. In this diagnostic mammogram, it's very obvious we're dealing with the fishy left side with the mass here and the distortion, increased density, the nipple affection, ulceration, and also there is the intramammary node is enlarged and suspicious. The AI tells me it's 69% and goes with him. Yes, it looks very suspicious on the mammogram. It's possibly a cancer. On the ultrasound, it was only complicated collection. It's the granulomatous mastitis with a large cavity and completed fluid within. So high scoring commonly goes yes with malignancy, except when I get a large area of involvement. Distortion, it's plus 20%, then heterogeneity, I comes again with another plus 20% to the percentage supplied by the AI. If there is increased density, then the glandular tissue, if there is vertical tissue infiltration and not longitudinal going in plane with the breast, and if there is large area of involvement. So in that condition, the exception condition that I'm going to take a high scoring percentage, although I'm dealing with a benign pathology. And then I'll come to the question of the lecture. The use of AI in the assessment of mammogram, it is a privilege or dispensable. This case, I'm going to do the both mammograms by comparison. I'll find here these areas of asymmetrical densities, and it's more evident on the CC that I'm dealing with the despiculated and distortion. It's by REDS 4. On the left side, I can't find any abnormality. The eye tells me no, both breasts are affected. The one on the right side, yes, it's not fishy, it's evident that we are dealing with a cancer. And on the left side, please take care, there is an area here in upper outer quadrant of the left breast with about 50% considered to be cancer as well. I'll go to the ultrasound and I'm confirmed about the right breast carcinoma. For the left side, I can't find the abnormality. I go for the contrast of the image and do more magnification because it's not obvious to the human eye, and I found this cluster of suspicious microcalcification. For the contrast enhanced mammogram, the calcification didn't show uptake, and only the mass on the right side with the contrast enhancement. The one on the right side, it was proved to be invasive ductal carcinoma, and the one on the left was atypical ductal hyperplasia. After 1 year, the patient came for follow-up. Now I'm having a scar on the right side, and actually I can't do the follow-up by the mammogram because it is not the specific modality for follow-up discarding. And what about the left side calcification? It's more or less the same distribution, and I don't know if I'm going to give the patient another biopsy or wait for another follow-up. It's a very critical condition. The AI scanning tells me no, the scarring area is of low probability of having a cancer. And when AI tells me there is no probability of having a cancer in a scarring which is distorted and with ill definition, so it's evident that there is nothing out there. The only false positive condition is the one common and not the false negative. And with regard to the calcification, the percentage was decreased. It was 42%. So why not use the AI for the uncomplicated postoperative breast cancer and also for the indeterminate calcification? Now the deep neural network artificial intelligence shows higher breast cancer detection compared to the mammographic density. And we thought why not to go a year earlier than the one with the detection of the cancer and see if the AI could discover her cancer earlier its actual performance. On the ultrasound there was nothing there. And what about the calcification? It was overlooked in 2019. We didn't pick it at the time. But by the AI precognition, there was the mass here, but it was only 34%. And if we knew about the AI, we could give her the chance for only a small follow-up, not for the annual. Although we have to appreciate that it was picked with, which was only 5 millimeter. It was an early cancer detection. And for the left side, the calcification was 58%, not 50 at the time we have shown before. And when we go for this, it's very marvelous appearance. When you go follow up for the patient with a numerical estimate and color hue, you could only in one glance determine the progression or the regression of the case. AI assessed the radiologist in reading the mammograms, improved the efficacy in screening of the breast cancer with a numerical estimate and very evident follow-up color hue. So AI finishes your sentence, and this is the idea. You need to be specific about your findings in order to get the proper solution from the AI. And according to our results, actually it enhances the specs and the statistical indices of the modality of the digital mammogram and ultrasound, gives us above 90% in almost all the indices. It's well known about the movie of Harry Potter. It's the Chamber of Secrets. And in the movie, his master tells him it's our choices that show what we truly are, far from than our abilities. We can have so much abilities and so much facilities, but we do not know what to do or what to choose. And actually, we need for this era to choose the AI. It is very important for the radiologist. It can target tiny cancer easily in less time and the calcification properly categorized. It also enhances the specificity of the digital mammogram in discrimination between the benign and malignant breast abnormalities. There is this contrast between the mammogram and the AI abnormality, recall is needed for an ultrasound. It picks the low scoring abnormalities and help for characterization and recategorization of the high scoring lesions. And what about to use the AI not for detection or for the diagnosis? You could use it also for the follow-up of the uncomplicated post-operative breast cancer, and for the indeterminate calcification, you could save your patients from the hazards of the repeated biopsies and the anxiety. It also could be considered as an option supported by ultrasound for the abbreviated MRI in screening high-risk patients with dense breast. And finally, for more time again, low AI scoring in dense breast doesn't mean normal mammogram. It's only suggested that we are dealing with a low suspicion of malignancy, so please consider ultrasound is required to exclude the presence of Barrett 2 and 3 lesions that needed for follow-up. Thank you so much.